I recently had exploratory surgery on my 26th birthday to check for endometriosis. This was totally voluntary, but I had this surgery like hanging over my head since the fall, and so when the scheduler finally reached out with the dates, it was going to be either my birthday or sometime later in the spring, and I was like, let's just get this over with. Like, I just wanted it done. I have a connective tissue disorder that affects literally every part of my body, and so going into the surgery, I had a feeling it wouldn't be endometriosis. Like, in my head, that would be way too simple. And so it was an endometriosis, which I am not complaining about. Like, I'm like, that was a birthday gift, knowing I don't have endometriosis. Like, I'm glad that is not something I have to deal with, but I do have pain and burning after sex, and I need to figure out how to deal with that. And this is an issue I've been dealing with since 2019, and I've seen a urologist and a pelvic floor specialist, and I've been in physical therapy and tried medicines, and I've really done everything in my care plan. So it really reached the point where we had to go in there and look and see if it was endometriosis. I think it's absolutely ridiculous that the only way to definitively check for endometriosis is cutting you open, but that is what they have to do. Now that we know it isn't, we will probably do Botox in the pelvic floor muscles to see if that gets things to like relax and maybe ease this like burning sensation. But it's one of those where you get one answer and then you get like 3 more question marks. And so, but I feel like that is like, if you have a chronic pain condition or any sort of like chronic illness, I feel like that is kind of how the cookie fucking crumbles.